My name is Larisa Geskin. I am a professor of dermatology and internal medicine at Columbia University, and I am a director of Skin Cancer Center at Columbia. And I've been treating CTCL patients for my entire career, almost 25 years. The CTCL is extremely challenging to diagnose. In fact, some studies show that the delay between onset of symptoms to diagnosis may be 3-4 years, and some publications up to 8 years and even longer. So some patients may have this disease that is incurable and difficult to treat and may not even know it. And the reason that it's so difficult to diagnose is because it can look like common rashes like eczema or psoriasis, and doctors may be mistaken by looking at this. They may not think about that the patient may have cutaneous lymphoma, and it's a truly challenge to arrive to diagnosis on time. So it's unlikely that primary care will make this diagnosis because very few primary care are even aware of it. And this is one of the obstacles to the diagnosis. Usually the dermatologists who try many different treatments over the years, all of a sudden may think about this. Maybe it is CTCL, maybe I need to biopsy it. The challenge is that even if you biopsy, it doesn't necessarily give you the diagnosis because the biopsies can also be what we call non-specific. It can show features of benign dermatosis, such as eczema or psoriasis. And unless that biopsy is looked at by a professional dermatopathologist who is a specialist, the diagnosis can easily be missed even on the biopsy. So there are several things that we are working on to try to arrive to diagnosis earlier. One of the main things in arriving to diagnosis early is actually quite simple. It is to think about it. If you think about diagnosis of cutaneous lymphoma, then you will go along that path of diagnosis. And the path of diagnosis may not necessarily be you see the rash, you do the biopsy, and you arrive to diagnosis. As I explained earlier, the biopsies may be non-consistent, non-specific, and we may need to repeat those biopsies time to time to eventually arrive to diagnosis. But what's important is that when you think about this diagnosis, then you may consider treatments that may not be harmful. And that's the main thing. So if you treat this condition as benign dermatosis, some of the drugs that we use are actually harmful or may be harmful to cutaneous lymphoma patients. And so it's very important to think about cutaneous lymphomas when you treat these diseases, especially with the systemic drugs such as TNF alpha inhibitors, maybe Dupixent, maybe some other antibodies that we use, or some other chemotherapy agents like cyclosporin, for example. It's extremely important to avoid those things that may be harmful if you think the patient may have cutaneous lymphoma even before diagnosis. So one of the things that truly is helpful to a general dermatologist is to understand that there are specialists and multidisciplinary clinics around the country, and we all are eager to stretch our arms to advise and maybe help with the workup or help with the thought process, or sometimes actual physical referral to one of the multidisciplinary team centers and specialists to help out. So I really feel that the general dermatologists may not be aware of this army of specialists that are available to them. And I think this is the key component of arriving to diagnosis earlier and to treating the patients more appropriately and more efficiently. And one more little note on a side about the correct diagnosis and timely diagnosis is also a dermatopathology. If dermatopathologist who looks at the biopsy and who is familiar with the condition, they are much more likely to recognize the condition on the tissue specimen. And it's very important, again, to deliver that biopsy that you do to a specialist who is actually looking at those cases and aware of the intricacies of the mycosis fungoides and other cutaneous T-cell lymphomas and B-cell lymphomas. The team is usually composed of number of specialists, not just dermatologists and dermatopathologists, but also involve oncologists, radiation oncologists, radiologists, sometimes nutritionists, social workers. So our team, for example, includes many specialists, including psychologists and psychiatrists dealing with the new diagnosis, which is very difficult for patients, at least initially may be very difficult. And so we truly dedicated to our patients, and we're truly trying to structure this multidisciplinary team around this um, kind of various aspects of patient care so we can help not only physically, not only with the disease signs and symptoms, but also nutritionally, also psychologically, also building a healthier lifestyle for the patients and arranging the families and friends around the patient with our support groups that we run for our patients. Communication is so important, and communication is really a key to success in treating these patients. The communication not only between patient and directly with the physician that are directly involved in their care, but communication of multidisciplinary teams with the primary dermatologist, primary oncologist, primary care physician, with the patient. So it's a truly multi-lane street. It's not even two-way street. It's multi-way street that we have to maintain and communicate with all of the physicians, patients, family members who are involved with that particular patient. Some teams are more kind of oncologist heavy and some dermatologist heavy and some are balanced. I feel like our team is very balanced with the dermatology and oncology. We have several actually oncologists on board, including Dr. Barbara Pro and Seda Tolu, who actually just finished her fellowship and joined us as a faculty. We're very lucky to have this young doctor joining our team. We have our radiation oncologist also quite involved, and this is a very key figure for maintenance of therapy for these patients. And again, communication between all of these members and primary care dermatologist is important. But who drives the care primarily? It depends. It depends on the patient, on patient's disease characteristics. Usually, if it's more early stage disease, it's handled more heavily by dermatologists. And when it switches to more advanced disease, it truly becomes an oncology kind of primary care physician. But dermatologists still play a significant role through all the stages. I'm certainly involved through every single stage of this patients from very beginning to very advanced stages because skin is a main issue for these patients. They truly suffer tremendously from the skin ailment from the cutaneous lymphoma, and they need help of dermatologists to deal with the day-to-day issues that the patients may have due to their skin involvement. This is actually a wonderful document that came up with 12 recommendations to improve awareness and to improve care of patients with cutaneous lymphomas. And I think the main message of those recommendations is exactly what we already hit on, is communication and support. Communication between various aspects of patient's care, between primary physician and multidisciplinary teams, back and forth, support of um, not only insurances, but actually government facilities, providing more care, providing more resources. And this is such a key to actually ensuring that not only the patients are diagnosed properly, but also cared properly with all the available resources available to every single patient with cutaneous lymphomas. We're dealing with a rare disease, and we do not have enough support from research funding, from psychological, sociological support, financial support for these patients and for physicians who are conducting research in this disease. And so this is it truly hit it on a head, and it truly drove it home to ask for support on many different levels, and to try to provide such support to physicians who care for patients with cutaneous lymphomas and for patients who suffer from it. One of the most important things, and I have to really commend Cutaneous Lymphoma Foundation on doing such a wonderful job in supporting our patients, is advocacy for our patients and advocacy for our field, for support of our patients on various support groups, various support for not only patients but also for caregivers. This is the disease that affects us all, not just one person, not just one patient. It truly affects families. It truly affects the whole community around these patients. And so Cutaneous Lymphoma Foundation truly appreciates that impact of the disease. And I just want to say thank you to Cutaneous Lymphoma Foundation for doing such a wonderful job.